I think the stat was by 2050, we're set to be spending about $330 billion a year on chronic pain in Australia alone. And one of the leading causes of death, right, is prescription medication, prescription pain medication, opioid-based, by your doctor, right? And the complications that come from that kill more people every year in Australia than every other drug combined. And in America, it kills more people than guns.
Welcome, Peter. Thank you for coming on to our show, and just like to ask you what your thoughts are on COVID and the physiology world, how that's panning out.
Yes, I mean, I'm in Adelaide at the moment, so physiotherapy hasn't really been affected too much by COVID. We had that one like 38-minute lockdown, I think it was, back in November. We're just trying to be like Victoria a little bit, I guess. So we had a slight lockdown there, but apart from that, we haven't seen too much change. We had a period of having to wear masks, but here in Adelaide, it's pretty sweet. I understand in other parts of Australia, there are still some more restrictions at the moment, and in other parts of the world, there's a lot more restrictions. So we're very fortunate at the moment, I'd say.
So what can you tell me about the healthcare industry and physiotherapy? I know there's a lot of controversy about the new wave of exercise physiologists versus physiotherapists. So I'd like to dispel a few myths around physiotherapy, because I've experienced the good, the bad, and the ugly. So what's your take on it?
Yeah, look, I'd like to see a fight to the death of physios versus exercise physiologists, because I reckon we pip them there. We get some real good core strength, I guess. But I guess getting down to the crux of it, I find it kind of sad, really, the fact that as physiotherapists, exercise physiology has become an actual profession. The only reason that profession has come up, and the reason they're so good at what they do, I'm friends with many exercise physiologists, is because obviously as physios, we weren't doing that well enough. And for a long period of time, physios have maybe neglected to really continue to push the boundaries of evidence and really keeping that sort of, how would you say, moving the exercise and strength and conditioning forwards. And as a result, there's been a whole new profession pop up called exercise physiology. And to be honest, when I look across many different professions, whether that's physio, osteo, chiro, exercise physiology, the good ones, they all do very similar things. They all have progressive resistance training programs. They all listen really well. They all create a plan. And long term, what I'd like to see is that there's no more physio, chiro, osteo, ex-phys. It's just you're a health professional, maybe you're a health coach, because we should all be doing the same thing. There shouldn't be distinctions. We all do very much the same thing. And I would like to see one title and this lose the silos and the factions, personally.
That's interesting, because I know anybody who's learned it in their craft. I deal with a personal trainer, and they say, "Oh, so personal trainers only trained for 6 months, and yeah, they're not that high quality." But I'm dealing with a personal trainer at the moment who is outstanding. I don't know what other extra studies he's done, but he's right up there with the best of them, and he's fully aware of anatomy and physiology and all the implications. But I really think with your profession as a physiotherapist, it comes down to the relationships that you create with your clients and the ongoing follow through and the goals and visions you have for your clients, rather than just treating an injury or dealing with things in isolation. It's like people have accountants for 20 years. They have doctors for 30 years. And they say, I'm going to the physio, or I'm going to see an exercise physiologist or a personal trainer. So how does it work for you with the personal relationships with your clients?
Well, I think firstly on that, my doctor is probably getting to retirement age soon, and I'm super upset about it. I'm very, very upset about that one. So I completely understand where you're coming from with that. And from a physio point of view, ideally, what we want to do is we want to get people better so that they're not reliant on us. But we do want to create a relationship that if they do get another injury, that they come back to see us that next time because they like and trust us, and they know that we're going to take them down the path of getting them back to what they love doing. We're not just going to tell people to stop doing the things that they love doing. If they do have to stop something, we want to find maybe an alternate activity they can do in the meantime until we can get them back to that. And so relationships are huge, and any business, people do business with people they like. And so relationships in healthcare make up a large part of it. But not only that, not only the fact that people come back because they like someone, but you actually get better results with someone that you like. And it makes a lot of sense. And we're starting to see more and more research come out in this now, is that the rapport you build with the person in front of you, that plays a large role in that person's treatment outcome. And there's lots of reasons they feel for this. And, part of it's that person feeling safe and secure, them feeling heard. Often someone comes in, they say, no one's actually listened to my story yet. And so to just listen to someone can provide the same pain relief as actually other evidence-based methods just by listening to someone, which is huge. There's things like they're more likely to do what you ask them to do. As a physio, if we give someone rehab exercises, we often do it for a reason. We'd like to see them actually do that because we feel like it's actually going to help them. And if they like you, they're more likely to do them. So there's a whole myriad of reasons. I could go many, many more of why relationships are so important, not just in building a business long-term and having loyal customers who refer their friends and family, but also in getting genuine, real results for people. And so when you look at it from both angles, the number one thing we have to do early on is create an amazing relationship with that person in front of us.
Well, one of the things that attracted me to invite you to the show is that you've demonstrated success in the area of innovation and training, and you won the Telstra Small and Succeeding Business Award for Innovation in Leadership, Digital Strategy and Client Care. So that means your attention to detail, your application to clients and to the actual physiotherapy business must be at the high end. So I'd love to hear your thoughts, how you got to that level of interactivity and recognition. What are the things that you've done differently than others in your field that have just stayed in a two-man band around the corner sort of thing?
It's a good question. Reflecting on a few things, we started out very, very small. It was just my business partner and I in separate sort of CrossFit gyms, which are not very nice places. They're little sheds in industrial streets. Mine was next to a power plant and a scrap metal yard. So you get the nice little picture if it wasn't beautiful. Didn't even have a light out the front. I would say for me, it was creating the client experience. That was really important. So when someone comes in, what's the feel straight away? And it's not just what happens within that treatment room. We don't just want to focus on that. So at our clinics, we try and have massage chairs in the waiting room. We've got really nice bean-made coffee, herbal teas, free Wi-Fi. We've got charging docks for your phones. So we focus on that whole experience from start to finish, not just what happens within that treatment, which I feel is a lot of physios are really good in the treatment room, but what happens before and after, and how can we really make the most of that? The same way when someone maybe flies business class, they go to a nice airport lounge first, and then they go on the flight. And then afterwards, most likely, someone will help them get off and help them to get their bag. If you can take that experience and take that into healthcare, I think healthcare is very focused on patients and getting people better. But sometimes we miss the fact that these little things mean a lot to people. And it's the little things that really do matter. And so what we did was we looked outside of the healthcare industry. So we thought, rather than just looking at what are the best healthcare businesses, we said, what are the best client service businesses? Because that's what we are. We're a service for people. They choose where they come to spend their money. So how can we really serve people better? And when we looked at it as a whole like that, suddenly we got all these other ideas for how we can nurture our clients better, how we can provide a better service all around. And even in the treatment room, we've gone and bought a bloody expensive anti-gravity treadmill because it's going to help the type of people that we work with. We have full gyms with Olympic platforms and squat racks so that when people come in and say, I get pain when I squat 240 kilos, I can watch that person squat 240 kilos. Whereas at the clinic I used to work at, I think we had about 10 kilos. And you wouldn't see where that movement's breaking down for someone who can squat that much just seeing them squat 10 kilos. So for us, it was of the utmost importance to really go, what is going to give people the best experience here, so that not only can we get them better, but they're going to go home, they're going to rave to their friends and their family about what we do. And this might sound a little bit arrogant, but I think we do give people a really good outcome. I think people who come to see us generally get a really, really good outcome, pain resolution, and they can hit their goals. And so the more of their friends and family that they tell about us, the more people we can genuinely help. So that plays into it.
I guess I don't see it as arrogance. I see it as confidence, because people are interested to some degree what you know and your skill sets, but the real penetrating issue to retain clients and have them sing your praises is when you can demonstrate that you really do actually care. And the attention to detail to those fine experiences, that they might be sitting outside with anxiety, or they might come in and not have confidence that you have confidence. But if they see that you are a person that's confident, that's part of the placebo effect of getting well. So they say, well, this guy's got his act together. His business is looking good. You know, you don't go to a sick doctor for practicing or a broke accountant. So when they see that you are holding yourself well in equipoise, in confidence, and the expression of your clinic is clean and tidy, and it has those functionalities, they feel they're in the right place. So that's probably why, you know, you've been recognised as one of the top 40 entrepreneurs under 40 in Australia, you know, so in South Australia. So tell me, what is it about iMoveU practitioner training? What is iMoveU? What is that about?
So iMoveU it's exactly like you said, practitioner training. We go across lots of different allied health professionals with it, and we get a really big focus on the soft skills and helping people to be successful in their career. And I'll talk to physio here because physio is more my wheelhouse, and I'm more comfortable talking about that specifically. But we do work with osteos, chiros, speech paths, psychs, etc. The whole lot of allied health, really. But we focus very much on the soft skills and how people can really be successful in their career. Because in physio, the average career length, I think, is 4.7 years.
Wow.
And I find that really depressing, because if you think 4.7 years, now the average physio degree or master's is between 4 or 5 years, depending on what you do. You're studying for as long as you're working on average for many people. And I find that really depressing, because I think as physiotherapists, we can make a massive difference in people's lives. We can really help people who are in pain, who are in chronic pain. We can prevent people from getting to chronic pain. I think the stat was by 2050, we're set to be spending about $330 billion a year on chronic pain in Australia alone. And one of the leading causes of death, right, is prescription medication, prescription pain medication, opioid-based, by your doctor, right? That kills more people than every other drug combined, including illegal drugs. Right, so opioids that people get addicted to, it harms their kidneys, it does harm their body, and the complications that come from that kill more people every year in Australia than every other drug combined. And in America, it kills more people than guns.
That's scary.
It is scary, and it starts to put it in perspective that this is a real issue. This is a really big issue. We're not dealing with pain well. We're not making a big difference on a large scale as health professionals. It's just not happening. We like to think we're getting better, but the stats say as a whole, we're getting worse. Like, we're actually getting worse. We're helping people less. More harm is being done. And so when I reflect on that, iMoveU really came about with my friend Mick Risk and my business partner Andrew Zachariah, when we sort of came together and said, well, we've got to stop this. We've got to do something, because when we were young physios, we felt the same. We felt employees didn't care. There wasn't a client sort of centric model there, and it was a little bit depressing to work in. Didn't love it. So we thought, well, how can we help people to see the bigger picture and succeed? And that came back to creating iMoveU, which is an online practitioner training forum. We do some live events. It's mainly online, but how can we improve their soft skills so that they can create a better relationship or better rapport with that patient in front of them? because you don't get taught that very well at uni. And how can we teach that person how to be financially free? Well, what should they be doing? How do they build a list? Because when you work in private practice, you have to build a list. You have to do that yourself. It's something you're not really prepared for at uni. And how do you then start seeing patients you've never seen before? How do you work with those people? What are the questions you ask? What happens when someone's not happy with your service? Right? What do you do then? There's all these things that come up that when I left uni, I was like, sweet, we good. I got this. I know everything. I'm a physio. And after my first day, I was like, oh my Lord, what just happened to me? And it was that distinction. And iMoveU it's the program that we wish was there when we graduated. It's probably the most simple way to sum that up.
Well, I know that through the progression of your career and where you're at now, I first met you through clinic mastery, and I know helping the clinics get up to speed is just an amazing service, because inside of that clinic mastery and inside that thrust, there's a culture, there's a community. And what I realized is that I'll be 68 in 4 weeks, and I do not have any medicine. I have nutritionals in the house, but I don't have any, not even a Panadol. I don't have medicine in my house, and I don't take medicine. And when I fill out the forms, they go, "What? You're not on anything?" And I say, "Well, what I'm on, I'm not on drugs, but I'm on being well and happy." And I think when you deal with people who are out in the field practicing to other people, they've got needs as well, and health needs. And I think health is such an integral thing. It's a system. And if you're a practitioner and your practice isn't going well, then your wealth health is not good, or your family health is not good, or your mindset health is not good. And that rubs off on the patients, and it rubs off on you as well. So I can see that you've really gone out way beyond the normal boundaries of just running an inverted commas practice. So where do you see yourself in the future with this trajectory that you're on?
Also a very good question. One I pondered over the weekend, actually. So here's my pre-prepared response. Cool. In the different areas at Physio Fit, we've got 2 of our team members who are going to be buying some equity within the business. It's a multi-D business, but they're going to become directors, which is really cool. It's going to allow them the opportunity to really grow and progress in their career, which is fantastic. And it's going to help to grow that business more, having a couple more chefs in the kitchen there, I believe. And if we look at iMoveU, we've set some lofty goals. We'd really like to be helping 1,000 health professionals. I was going to say physios, my bad. Health professionals through our online course, which we're getting ready to release over the next 3 to 4 weeks, just in final stages there. And that's going to be a 12-month sort of subscription product where we take people from wherever they are to help them plan, help them work through the different communication issues that arise, help them work through being successful in private practice, and then dive a little bit deeper into some of the niche sort of areas of treating people and being a bit more specific, as well as providing some real sort of expert insights from different guests. So we're really excited to aim to help 1,000 people this year, but really grow that. That'd be awesome if we could get, have by 5 years' time, have 10,000 people have gone through that.
Awesome.
Because the knock-on effect of that, each practitioner probably sees 50 patients a week. Now we're talking 50 a week times 48 weeks in a year. Hopefully they take some holidays. You're looking 10,000 times 48 times 50. Like, we're starting to talk some large numbers of people, the impact that it has by doing a course like that. So that's one of the really big goals. And then with Clinic Mastery, which is where we help business owners to grow their clinics through amazing client experiences, as well as amazing team experiences, and helping them to really build great cultures. We'd like to be helping, I think it was 500 clinic owners by the end of next year. And we're well on our way to be doing that as well. That's just gaining a lot of momentum at the moment, because I feel like we're getting good results, and I feel like we're doing it in a really ethical way. We're not just jumping in and saying charge people more and send out these 20 emails and, pester people until they book in. It's, well, no, how can we provide real value to your team so they want to stay? How can we provide real value to your clients so that they want to come? And how do we provide great educational content to your community so that they understand how you can help them?
Well,
And that's how we're.
the exciting part for me getting
Mm,
involved in clinic mastery was through Sage Active Clinic when I went down there as a participant for exercise physiology and myotherapy. And then I ended up working hand in hand with Rob, sort of like a 2IC in a way. But what I was starting to see is, yes, I was getting my needs met because I may say no medication, but a few injuries and limitations certainly, and they needed to be dealt with through exercise physiology. And what I noticed is in the gyms, unfortunately, they're outside their scope of practice if they're trying to help a lot of mature age people. They're just not trained to deliver that sort of service to the people. What I did see through having a myo physio scientist and physiologist combination, so I started to see mature age people, 60, 70, 80, even 90, get results and get back in the game. And that's exciting for me because my optimism is that, I'll still be able to dance at 100. I'm pretty keen to stay in the game and play. There's a lot of people my age got the walking frames and it's all over. They made poor choices. But for me, I'm always looking at the health and wellness community. Hence, I started the FKC Health channel. And to many people's chagrin, they're a bit surprised that I've invited such a cross-section of people from different camps. But what's happening is there's a new renaissance happening where people are saying, well, hang on, we're all providing care. Stop going into our silos and start to realise where people care is we have specific skills. And I've actually set up meetings between personal trainers, exercise physiologists, chiropractors. Early in the piece when I started to do this, they felt a bit strange in each other's company. Now it's becoming more the norm and acceptable for people to start to share their modalities, refer their people across, not feel afraid they're going to lose a client, but the person realises if they're going to be educated for self-care, they've got to access all these health professionals and you can't provide everything. No one can. So how's that work in your clinic as far as referral in and referral out?
Yeah, I think for us, it just comes down to the model of if you were to draw a circle right now and you put the client in the middle, it's all about the client. And I think the issue with not referring on when it's appropriate comes when you put the practitioner or the business in the middle, and it's about that person mostly. So when it's about the client, if someone comes in to see you and you go, you know what, I'm not the right person to see you, right? There's someone who could do this better, who will get you a better result. That's what we expect. We expect that person to be referred on if it's appropriate. If you can help that person, absolutely. And sometimes it's just a second opinion. For example, we've got massage, physio, podiatry, sports doctor, and a surgeon at our clinic. And if you were to look at referrals maybe to the sports doctor, maybe it's something that comes in and you're like, oof, I don't know, maybe we do need a scan on this because this athlete really wants to get back and we just want to rule something out. Cool. Now we know we can't refer for an MRI and to get a bulk build, or it'll cost them more coming from physio. Cool. Make that referral to the sports doc. Or someone comes in with a foot issue, like as physios, like we try and pretend feet don't exist. So if someone comes in with a foot issue, let's pass that to the pod. That's what they do. That's their wheelhouse. I think it really just comes down to put the patient in the center of that circle and just ask yourself, what is the best thing for this patient? If this person was my mum, what would I want done with her? And I think it's quite simple.
Well, one of the big issues for mature age people and younger, but mature age people is shoulder injuries. And some of those shoulder injuries can be so super complex, and people say, I've gone to the physio, I've gone to the exercise physiologist, I've had the myotherapy, but I've still got this shoulder issue. But if there's a tendon detachment that no one's picked up, it's only going to be through an MRI you're going to find it. So there's always this cross-sectional evaluation of your challenges if you're game enough. And I notice with good practitioners, they'll rub their chin sometimes and say, you know what, I think I need to refer you to find out more, and then I can treat you more specifically or intelligently. So it's pretty cool. And I know that you have a passion around social media for your strategy in healthcare. Can you tell us a little bit about that?
Yeah, absolutely. And I'm just going to jump back for a second because you talked about maybe there's a tendon detached or something like that. My question to anyone listening is that relevant? And hopefully that challenges a few people listening to this or watching this. And I'll put in perspective, I have a completely torn supraspinatus and subscapularis in my right shoulder. I was a like semi-elite tennis player, very common sort of issue. I've never had shoulder pain. I lift very heavy weights. Well, I think they're very heavy anyway, at the gym, and I don't get any issues at all. And we do know that, and an important distinction is that scans show anatomy, they don't show pain. And there's a lot of age-related changes that will show up on a scan that we then, as humans, go A equals B, correlation equals causation. And even things such as, a tendon not being attached anymore, your body's very good at adapting, and it might not be the actual issue. And too often we're very, very quick to jump in and go, oof, let's fix this with this real fixer mindset rather than ask the real question, which is, was this here before the pain? Anywho, we'll jump onto social media. Like you said, I love social media.
Before we get that, let's go back on that. I threw my arm out playing table tennis like 30 years ago, and I had those issues. And I can lift some pretty heavy weights for my age, and I do some amazing things. And then out of the blue, every now and then, I've got this really sore pain, and I can't tie it down or relate it to anything. I go, damn, I've got the shoulder pain again. And it may or may not have happened while I was doing that exercise. I might just reach behind me or something like that, and it's sharp and it hurts and it stays there. So, yeah, there's always an evaluation process. But yeah, we'll jump back to the social media.
Yeah. So social media, which is where I talk about a lot of this stuff, and I do like to ruffle a few feathers by challenging people. I recently did one talking about scans and how scans, like I just said, scans show anatomy, they don't show pain, which is very challenging to a lot of people because we like to believe that a scan is going to tell us all of our problems and the solutions to those. But I feel like social media is a great tool to educate and inform people. And if we're not using social media as health professionals these days to really educate people on health literacy, then I believe we're doing them a disservice. I believe it's part of our role as health professionals it's not just to treat the person in front of us who pays for our service. I really believe that part of our role is to educate people about evidence and take this complex evidence that comes out and then distill it down into something that's entertaining so people will watch it, because it's boring, no one's going to watch it. Make it entertaining, but at the same time informative, so they can start to learn about their body and you can start to challenge them. Right? And I believe it's a very hard thing to do at the moment because there's a lot of people who, even in physio, there's a lot of physios. I'll pick on physios because I'm a physio, it's easy. There's a lot of physios who still are in this fixer mindset of get a scan, see what's wrong, try and fix this thing. But we know that's just not how the body works. Like, we know pain is an output from the brain, not an input to the brain. We know that degeneration is a normal part of aging, like a gray hair. Okay, it really challenges people to hear these things. But the more we can do this, we know the more people who are starting to understand that, hey, I don't need to go get adjusted every week for the rest of my life. There's nothing to adjust there. All right. The more we can educate people about what's happening within their body, about maybe why a scan isn't the best first option. Because when you hurt your back, what do? You go to the doctor and then you go to get a scan. The scan says you've got this wrong with you. You get degeneration, some herniation, loss of disc height. Maybe there's some disc signal loss, and maybe there's a tiny bit of impingement on the nerve root. And you start to freak out. You start to go, whoa, what have I done to my back? And we know that this actually makes you worse. This makes you worse.
It's the language.
It's very scary language. And so someone gets a scan and then they're like, I'm broken, I'm fragile. And this plays into them not exercising and not doing movement. and they get stuck in this circle of avoiding. And when they avoid movements, guess what? They get weaker and they get less used to them. And we know that probably the number one risk factor for any sort of pain is to do a movement that you're not used to and to increase that load. And so the more you step back from things, the more likely you are to actually fall into pain. Now, that's not to say that don't step back from things. We may need to pull things back very slightly for a period of time, but we need to understand the process that's going on. And we really, unless it's actually going to be useful and we think there's a red flag that we're screening for cancer or osteoporosis or a fracture or an actual real radiculopathy or a nerve injury, we should really not be referring for a scan because we know it's going to make that patient worse.
Well, there's so many ways. Like, for instance, I try certain leg exercises and I've got some knee issues, but some of the people that I work with, the exercise physiologists and the trainers, say, well, we can come at that exercise from a totally different perspective. And I might do 5 or 6 seemingly unrelated exercises, and then go back to that exercise that was giving me pain. I go, what just happened? There's no pain. They said, oh, what was happening is there was micro muscle movement there, and we strengthened this here and there, and now you're ready for the exercise. And it can happen even in one session. So this knowledge is not available to the man in the street until he goes and sees professional practitioners. This is really fantastic stuff, what you're doing and helping people. How do people get in touch with you?
Depends what they're after. If they'd like to book an appointment at Physio Fit, it's physiofitadelaide.com.au.
That's it.
If they like to follow Instagram, I'm not sure what that is, but you can post that underneath the podcast if you like. I wouldn't even be able to tell you my Instagram off the top of my head there, but that's the website, physiofitadelaide.com.au. And we do have lots of great resources on there. If you follow us on social media, on Instagram and Facebook, you'll also be able to pick up a whole lot of great resources. If you're a business owner and you want to learn about what we do and how we help people, that's clinicmastery.com. And if you're a practitioner and you're wanting to take that next step and really solidify your career and find fulfillment in your career, it's iMoveU.com.au. So a few little links there for you.
That's awesome. And what we'll do is we'll be putting that information and those links in the footnotes of the YouTube video. Well, there you have it, friends and family out there. And don't forget to subscribe and hit the bell. And thank you so much, Peter, for your precious time. And look forward to some more of this down the track.
Sounds good, mate. It's my pleasure. Thank you.